Hi, my name is Christopher Cox, and for my next video, I'm going to talk about the different patient assessments found with shock. So let's talk about it. With cardiogenic shock, we have cyanosis, cool skin, and motile extremities, peripheral pulses that are rapid and faint, jugular vein distension, and crackles. So we need to think about heart attack. Actually, myocardial infarctions are the leading cause of cardiogenic shock. That's why people get them. It's also known to have 70% to 90% death rate if it's not fixed correctly. So when I'm thinking about the cardiogenic shock, you have this decreased coronary perfusion pressure in the heart. It's going in the body, and you have this increased O2 demand. So that will explain your cyanosis because you don't have adequate perfusion, as we talked about in our last video. So you're gonna have decreased oxygenation to your tissues, which is gonna present why your patient has cyanosis. So if you think about this, you can give your patient oxygen, but also you can try to think about ways that we can improve their heart, how we can improve cardiac output. That's something to consider. Now, with distributive shock, we have relative hypoxemia, hypotension, and an increased heart rate greater than 90 beats per minute. So with distributive shock, one of the things that are common is mental status change. So we need to remember that. Now, with septic shock, you have tachycardias, delayed capillary refill, a fast respiratory rate, fever, grayish skin, and anxiety. Now, what helps me remember septic shock is think about localized infections, because that's what is causing sepsis, is a localized infection that has not been taken care of. So one of the things maybe we can give to help, fix this problem is antibiotics, but we'll get into that later. And finally, we have obstructive shock, which has the pulsus paradoxus, which is a decreased systolic blood pressure of greater than 10 millimeters of mercury on inspiration. So with this one, think about cardiac effects, because this decrease in systolic pressure is affecting you. It's not normal. It's not that 120/80. So that's something to consider. So that's the different patient assessments and how we can categorize those. And my source was emedicine.com. Thanks.